Capitol Report is a production of Senate Media Services.
This week, the Senate adjourns sine die after a controversial review of some governor-appointed state agency heads. And Senate leaders in taxes and health and human services offer highlights of their respective omnibus bills. Stay tuned for this and more on this week's Capitol Report. Welcome to this week's program. I'm Shannon Loehrke. The legislature was able to pass a new state budget, finishing their work in the nick of time. In the coming weeks, we plan to bring you interviews with the Senate leaders of the various budget areas. And we begin today with the Chair of Health and Human Services, Senator Michelle Benson. Thank you so much for joining me.
I'm glad to be here. Thank you for inviting me.
The Senate passed the Omnibus Health and Human Services bill on a vote of 62-4, so almost unanimous support. Your House counterpart, Representative Tina Liebling, called this the best HHS bill that we've seen in a generation. What's your perspective?
Well, I would say it was certainly the most expensive and the biggest. I know we're going to talk about federal funds, but about $1.2 billion in federal money, one-time federal money, was put into this Health and Human Services budget area. So there were some things that were my priorities, making sure we had a robust public health system, making sure that newborn screening included the Vivian Act carried by Senator Karn Housley to protect newborns from preventable deafness and other congenital and neonate problems, making sure that our Department of Health, as it comes out of the pandemic, is stable. At the Department of Human Services, making sure that our private healthcare market could be protected and robust, and we have a stable public program system with program integrity built in. And that's the part that I thought was missing the most, was some program integrity with all this spending, hoping that our existing integrity infrastructure really supported the increase in spending. But additional federal funds for home and community-based services, additional federal funds for mental health, additional federal funds for substance use disorder, additional federal funds for child care. It's very hard to spend $1.2 billion in 2.5 years and not create some ongoing spending. So there are some really good things as we recover from the pandemic, awareness that telehealth and child care stabilization are going to be important to get our economy going. But it was a great opportunity to restabilize after COVID.
So there's a lot to unpack in what you just said. And the first part is that influx of federal funds that you had. And I know it was important to your caucus to make sure that none of that money got stuck in the tails or was, was going to be spent in following years. So as you worked through that, what are some of the highlights of the one-time spending that you were able to do?
Right. Well, particularly in home and community-based services, we use some of that money for grants to help people convert their homes so they can stay there longer. There are nonprofits that will go into someone's home and widen doorways or put in ramps. We thought that was an important investment. As child care comes out of COVID and being partially shut down, they were given the opportunity to do some refurbishment and do some upgrades so that they can continue to attract more people and be ready for when people are fully engaged in the economy if they need childcare. So those are just a couple of highlights. Mental health investments, that was really important. One of the long-term side effects of not COVID, but our response to COVID is going to be the mental health impacts that this is having, the people who are feeling depressed and anxious. We have seen a considerable increase, particularly in pediatric and adolescent mental health crisis. We have full beds. We did put some pediatric mental health beds and some adult mental health beds into this bill. And I don't know that it will be enough, but it's an important start and a critical acknowledgement to those families who are suffering through mental health crisis. And we use some one-time money to help shore up our mental health system.
And you've expressed on several occasions your concern for the pediatric mental health in particular, but as a rule across the board, it is perhaps we're more aware, or it is increasing. And so there's one-time money going to that. Is there also some ongoing spending to support that?
Part of the money went to increase support that will continue long-term, but we tried to have that take a jump and then stay flat so that we don't build in massive spending increases in that area. It will have to compete with education and everything else. We did put in some substance use grants and mental health grants into our school systems so that where the kids are, and if as they return, particularly this fall, they're in crisis, they will have some support and hopefully keep them out of a place where they need inpatient treatment or where they end up being hospitalized.
Now, you said on the floor of the Senate that lessons learned from the COVID-19 pandemic are reflected in this bill. What are the lessons learned and how are they reflected?
Well, telehealth, which I know has been a big topic of conversation, this fundamental change in the way that we engage with the healthcare system. It was going to take 4, 5, 6 years to get here, and we accelerated it and did it in about 3 months. So what's the good that came out of that? We know that for mental health supports and substance use supports in particular, sometimes just that check-in phone call keeps people out of crisis. There's a lot of screening that you can do at home, and we're going to talk about mother-baby health. The Mayo Clinic is working on monitoring moms and babies remotely so that you don't have to take an entire day off work just to get a check-in appointment. They can do a remote monitoring, and some of that accelerated through the pandemic. Also, our public health infrastructure bent, didn't break, they held together, but they were stressed, and our public health infrastructure learned some important lessons about being able to coordinate, not just with our Department of Health, but regionally and with their hospital systems. And so we made sure that they got some funding, stable funding, but also some innovation grants so that if they want to hire an epidemiologist or upgrade some of their local facilities in partnership with their hospitals, they're going to be able to do that. We don't anticipate that there's going to be a COVID-like health crisis, but being able to respond to a regional measles outbreak is going to be important, not having everything in St. Paul, but having the whole state be strong in their public health response. And those are a couple of examples.
According to the Maternal Health Task Force at the Harvard Chan School, the U.S. is at the bottom among developed nations in preventing pregnancy-related deaths. There are provisions in this bill intended to improve maternal and newborn welfare. What are they?
Well, we expanded medical assistance coverage for moms postpartum. It was 60 days. The Senate took a 6-month position, but the House and the governor prevailed, so 12 months of coverage so that as moms might be going through difficulties with breastfeeding, we know that that bond with moms and babies is really important for babies' well-being, so they get support longer. Maternal postpartum depression is a significant factor in particularly suicide postpartum. And so this way they would have access to mental health care beyond 60 days and hopefully through the whole postpartum cycle. But also the ability when you bring your baby in for a well baby check, for you as a mom to be checked, because not everything that could go wrong postpartum happens in those first 60 days. And so we're hoping that that is one provision. But we also made sure there was a robust investment in home visiting so that particularly moms who are at risk, you know, if you are a stable family and you don't need help, that's fine. But there are some families who find challenges and could use some support through home visiting. We also took a specific approach. There's a great deal of health disparity in our maternal morbidity. And so helping doulas and midwives understand that there might be cultural differences in the birth experience. I'm guessing you and I had pretty similar birth experiences, but people who come from other cultures might not want that birth experience. So how do we safely acknowledge those cultural differences, but bring moms and babies to a healthy, safe place?
Senator Michelle Benson, it's so good to see you in person, and thank you.
It's good to be here in person. Thanks for the invitation.
The Senate remained in special session following the completion of the budget to take up confirmations of some of Governor Walz's appointed agency leaders, prompting a floor debate over the extended special session, the timing of the votes, and the sudden resignation of Minnesota Pollution Control Agency Commissioner Laura Bishop.
But I think the way that this issue of commissioners being brought up on an ad hoc basis because they get sideways with the majority party on an issue of policy is counter to the best wishes of the people of Minnesota. So members, we need to have that conversation. We need to have that elevated. We need the people of Minnesota to understand why this matters. We need to confirm all of the commissioners and other appointees in an appropriate process, but not to do it as a threat on a matter of policy. That is not our role as the Minnesota Senate.
Frankly, there was a number of reasons and a number of times that there was conversations with Commissioner Bishop about what she was doing and how she was doing it, and whether it was the lawsuit that she joined with the state of Michigan against the taconite industry that could have destroyed the taconite industry on the Iron Range and all of those blue-collar jobs up there because she decided she wanted to weigh in. She didn't have to do that. When she put forward the manure spreading language for farmers that have livestock and spread it out into the fields and into the fall, and she ran that through rulemaking, and we had to fight to get a couple extra weeks back. She didn't have to do that. When she decided to continue to push through the electric car mandates, when we asked that to be a legislative process, and she didn't have to do that. And as far as how she worked with a number of senators, barging into offices and expecting to just automatically come in, frankly, members, there were a lot of reasons why we were very, very concerned about how she performed as a commissioner.
This whole special session and this whole exercise of considering confirmations is a joke and a disgrace and a sham. Never before has the majority party of the Senate held fully 91% of the executive branch commissioners hostage in this manner, under the threat of dismissal when they stand up to do their jobs to fight for all of the people of Minnesota.
I do not view this as political gamesmanship or partisanship. I don't think it should be political theater. I view this as a constitutional responsibility of the Senate to review the job performance of commissioners appointed by the governor. And that is precisely what we have done. It is true that we, as the majority caucus, have not been particularly pleased with some of the commissioners, but others we certainly have been. We are prepared to confirm 2 more today. But insofar as the dust-up involving the commissioner of the Minnesota Pollution Control Agency yesterday, I believe that we really have been doing our constitutional due process and our duty. And speaking again just for myself, Commissioner Bishop did not do well at all by my constituents.
I've seen several really amazing things that Commissioner Bishop did around TCE in my community and communities surrounding that weren't mine, and the way that she handled herself. Folks, she comes from the chamber. If this person isn't good enough, I'm not sure what litmus test you guys are rising to at this point. It just boggles the mind.
Commissioner Bishop, Commissioner Strawman, all these other folks, they're more than halfway done with their job. It's 30 months since the governor made appointments. They only have 18 months to go. And the advice and consent, nowhere does it intend that to be a sword of Damocles where the sword is hanging over them, and as soon as we don't like something, we can cut off their heads.
When the governor makes a political appointment, and make no mistake, members, these commissioners are a political appointment. They are not the same as an employee. And when they're appointed, I have the honor of seeing their resumes, and they are incredible resumes. That's why they're usually appointed. But they have not served one day of their job. So to confirm them right away without knowing how they are going to perform in their job, I think is irresponsible.
The tax bill passed by the legislature and signed into law by Governor Tim Walz provides nearly $1 billion in tax reductions, incentives for job creation, and bonuses for frontline workers. This week, I spoke with the Senate Tax Chair Carla Nelson about the bill. Last week, before the tax bill came onto the Senate floor, you and I crossed the street together, and you excitedly told me about this good news tax bill. This is your first tax bill as Senate Tax Chair. And I wonder, I think you're pretty excited about it, yes?
Yes, I am. It is a good news tax bill, Shannon. You know, Minnesota is already one of the highest tax states in the nation, no matter how you kind of slice and dice, what numbers you look at there. And for Minnesotans who were struggling, those who lost their jobs through no fault of their own, for them to be taxed on those pandemic unemployment insurance benefits would have been devastating. Or for the businesses that kept their employees, kept the paychecks flowing, even though there was no commerce, there was no business, they were shut down. Yet for those employees not to be taxed then on those forgiven PPP loans would have been devastating. So the fact that we were able to successfully get this bill across the finish line that does not tax those benefits that really were lifelines sent to Minnesotans was a huge win for Minnesotans. And I am very excited about that. And then there's all the other good things that are in the tax bill too.
And we'll dig into a few of those. But as you know, Governor Walz and the DFL House had proposed tax increases. And it was important, I believe, to the Republican caucus to not have any tax increases. So as you mentioned, the PPP forgivable loans and the federal unemployment insurance will now not be taxed at the state level. What impact will this have? Why was it important to not increase taxes?
Well, it was so important as Minnesotans are digging out of the pandemic effects to be able to recover. You cannot tax the lifeline. So that was huge. And just to note, Minnesota is one of the most progressively taxed states in the nation as well. That means the more you make, not only do you have more to pay taxes on, but you pay at a higher rate. And when you combine that with our already high taxes, it is critical that Minnesota be a friendly state to workers, to new employees, to new employers. And one of the things we saw, Shannon, as we lived through the pandemic, remote work has continued and it's going to continue. And people are leaving places that are inhospitable to their livelihoods, their ability to raise a family comfortably, and they're moving to other states. We're seeing great tens of thousands of Californians, for example, leave. And it's very important for Minnesota that Minnesota is one of these states that, yes, has a high quality of living. It also has a reasonable tax climate that allow Minnesotans, Minnesota families to work and to also provide for their families in good order. And so it's very important for Minnesota that we not become one of those ultra high tax states.
The bill establishes a frontline worker grant program, creating a pot of $250 million that will be allocated to some of those frontline workers who kept going throughout the pandemic. What's the process going to be to disperse those funds?
Yes, these funds are so important. And I just want to mention, Shannon, that in my district, I had a number of frontline workers and I talked with them and their families all throughout the pandemic, virtually, of course. And the stress and the added expense of working with COVID patients, working in the emergency services, all of those type of things put them at great risk, and the extra lengths they had to go to try and protect their families. Some didn't go home. Some stayed in hotels, not wanting to bring the virus home. We just knew so little about the virus at that time. And so it's important that we try to make those workers whole. And that's what this $250 million federal dollars to frontline workers will do. In our September 6th likely special session, we will be appointing 3 senators, 3 House members. The governor will appoint 3 people to form that task force to determine what is the eligibility for those frontline worker we would call bonuses or compensation, and then how will that be distributed. And this provision was carried in the tax bill as far as the money that will be set aside, and then the formation of the kind of like a task force, a working group to figure out how best to disperse those funds to those frontline workers, those who put their lives at risk to save others.
On the Senate floor, you said this bill will empower Minnesotans and drive economic growth. There are credits and incentives for job creation, like the Oriented Strand Board project up in northern Minnesota. There's also the extension of the Angel Tax Credit. What else accomplishes the goals of empowerment and economic growth?
Sure. Let me just say the OSB will bring hundreds of jobs, which are critical. And of course, the angel investor not only brings jobs, but those new innovations, oftentimes in the world of healthcare, that help save lives. So we're excited about that. In addition, there's the historic structure tax credit, which is very exciting because it has had a great track record of saving those historic buildings, empowering them. Oftentimes our smaller local communities growth, whether it be hosting a brewing company or a small restaurant or some arts. It's just a phenomenal, successful program that has really helped save buildings, provide jobs, and provide also entertainment for oftentimes with our music as well, our legacy music as well.
The Wall Street Journal recently published an article about the trillions of dollars of wealth that baby boomers have, and how that is going to be transferred in coming years to their children. I assume this is going to have significant tax implications, and I'm wondering, in the future, is your tax committee really going to look into this?
Oh, we most definitely will, because there is a generational shift in wealth coming. The baby boomers being the largest prior to the millennials, and great wealth there. And there will be a transfer of that wealth. It's very important that Minnesota be a state that, number one, baby boomers will retire in. We see far too many baby boomers leaving our state because, as oftentimes their CPAs note, we know your heart is in Minnesota, you love Minnesota, but if you're just looking at the numbers, you really can't afford to retire in Minnesota. But if you even could afford to retire in Minnesota, you certainly can't afford to die in Minnesota. And that's because we tax Social Security. Most states do not. We also have very low levels of exclusion on the estate tax. So we do that, some call it death tax or double taxation, higher in Minnesota, much higher, significantly higher than at the federal level and as many states. And so we have to be very conscious of that and make sure that Minnesota, we are a state that will keep that wealth, keep its Minnesotans, and keep that wealth in our state. So we will definitely be looking at taxation on Social Security. I will be putting forth a plan to totally remove that taxation. It will need to be phased in over time. Iowa has done that. There's just no reason for Minnesota not to do that. So we will be addressing that next year.
Senator Karla Nelson, I want to thank you for your time today.
Thank you so much, Shannon.
The Minnesota State Capitol has reopened to the public. Here's a preview of one of the many historical spaces you can once again visit in person. The second floor of the state capitol is really the focal point of all of the activity that happens here. What was Cass Gilbert's idea behind this particular design?
The second floor is really called the grand floor of the Capitol because it's where everyone can come up here, get access to the chambers, the House, the Senate, and the Supreme Court. And it's a place where all that activity is taking place each day of session. So you have people lobbying for interest groups here. You have the public that are here to talk to their legislators and so forth, or go to the Supreme Court for their hearings. So really the envision that Cass Gilbert had for this space in the second floor was to be a grand space where you really get a sense of the architecture, these beautiful colonnades of Italian marble column and Minnesota stone, and you also get a place where people feel friendly or welcoming into those spaces as at the same time they're visiting or coming here for business.
In the other capitals I've visited, I've noticed that the House chamber is often across from the Senate chamber, but not here in our capitol. What is the reason for that?
Well, I think what Cass Gilbert was looking at doing is creating a symmetrical building. And so we have, in 1905, there were 63 senators, not the 67 we have today, but we had 119 House members. So that's almost twice the size. So I think for him, how you construct a building with one end of the building with a smaller chamber and the other opposite end with a huge chamber just doesn't fit architecturally. So he put the Senate chamber on the west side of the building, the Supreme Court, a smaller chamber of course, on the opposite end, and then the House, because of its size, fit perfectly in the north corridor or the north side of the buildings.
It may just be a matter of folklore, but I've read that the placement of the House chamber looking at the city of St. Paul is important in terms of representing the people, that the speaker is looking at the people. Is that true?
Yeah, and that's a lot of people look at the way the spaces have been designed or laid out, that Gilbert was looking at the House being kind of the approachable. It's more of the people's House. The members serve a 2-year term, so there's more rotation or more changeover as members leave or get reelected or not reelected.
And there are more of them.
And there's more of them as well. And so the idea is, it kind of symbolically, it faces the public, faces downtown St. Paul.
In 1905, when the Capitol opened, all of the state's constitutional offices were housed in this building, and that's not true today. Can you talk more about that?
Sure. The whole idea of the building here was this is the seat of state government. So you have your executive branch officers, you have the governor, lieutenant governor, the state treasurer, the state auditor, the secretary of state, the Attorney General, all housed within this one building in 1905. And that gives you a sense of how this building has changed over its 112-year history, as you have a lot of those constitutional officers moving out to different chambers. They're going into the state office building back in the 60s and the 70s. You had the administration building where the treasurer moved into it. Now the treasurer, we, as a constitutional amendment, abolished the treasurer's office, so there no longer is a treasurer. And that also fits in with the history of the Supreme Court too. They were, until the 1990s, everything they had here, the offices, the law library, the chamber, was their headquarters, kind of their center gathering place for all the work and all the business they do. And then when the Judicial Center was open, they moved there, and so they have new Supreme Court and Appellate Court offices and also chambers there. But they still use this space in the state capitol as an important part of their connection to this building.
Join us again next week as we delve into more topics affecting Minnesotans. I'm Shannon Loehrke, and on behalf of all of us at Senate Media Services, thanks for watching.